Hello, ladies and gentlemen. Welcome to today's video. This is the Cardiologist channel, and today we will discuss the definitions of atrial fibrillation, which are discussed in the ACC AHA 2023 Atrial Fibrillation Guidelines. Make sure that you subscribe to our channel and press the bell icon. Let's begin our video. The term atrial fibrillation is defined as a supraventricular tachyarrhythmia with uncoordinated atrial activation and ineffective atrial contraction. Electrocardiographic characteristics include 1. Irregular RR intervals when atrioventricular conduction is present, 2. Absence of distinct P waves, and 3. Irregular atrial activity, also known as fibrillatory waves. Atrial fibrillation can be documented by, for example, 12-lead ECG, rhythm strips, wearables, and intracardiac electrograms, but will always require visual confirmation that the diagnosis is accurate. With the increasing availability of wearable devices and other continuous monitoring technologies, the difference between clinical and subclinical AF has become increasingly blurred, and the term clinical AF is felt to be less useful. However, the term was kept because most of the evidence from randomized trials that have led to guideline recommendations for the treatment of AF refers to clinical AF. These trials required electrocardiographic documentation of the arrhythmia for inclusion, and most patients presented for clinical evaluation and/or therapy of the arrhythmia. Subclinical atrial fibrillation refers to this arrhythmia identified in individuals who do not have symptoms attributable to atrial fibrillation and in whom no previous ECGs are documenting atrial fibrillation. This includes AF identified by implanted devices, pacemakers, defibrillators, or implantable loop recorders, or wearable monitors. Atrial high-rate episodes. These are defined as atrial events exceeding the programmed detection rate limit set by the device. These are recorded by implanted devices but require visual inspection to confirm atrial fibrillation and exclude other atrial arrhythmias, artifacts, or overspending. AF burden. AF burden encompasses both frequency and duration and refers to the amount of AF that an individual has. AF burden has been defined differently across studies. In the present guidelines, AF burden is defined as the duration of an episode or as a percentage of AF duration during the monitoring period depending on how it was defined in the individual studies. First detected AF. It is defined as the first documentation of AF, regardless of previous symptoms. Paroxysmal AF refers to AF that is intermittent and terminates within 7 days of onset. Persistent AF. It is defined as AF that is continuous and sustains for more than 7 days and requires intervention. Of note, patients with persistent AF who, with therapy, become paroxysmal should still be defined as persistent, as this reflects their original pattern and is more useful to predict outcomes and define substrate. Long-standing persistent AF refers to AF that is continuous for more than 12 months in duration. Permanent AF, a term that is used when the patient and clinician make a joint decision to stop further attempts to restore and/or maintain sinus rhythm. Acceptance of atrial fibrillation represents a therapeutic decision and does not represent an inherent pathophysiological attribute of AF. Thank you for watching this video. We hope you have enjoyed our content. More videos are coming on this topic. So, make sure that you are subscribed and have pressed the bell icon. Also, consider liking, sharing, and commenting. It helps immensely.